This combination hormone medication is used to prevent pregnancy. It contains two hormones, norethindrone, a progestin, and ethinyl-estradiol, an estrogen. This product also contains a small amount of iron, ferrous fumarate, in inactive tablets taken during the 4th week. The inactive pills do not contain any hormones. These tablets are meant to keep you in the habit of taking one tablet each day and do not have enough iron to treat iron deficiency. Besides preventing pregnancy, birth control pills may make your periods more regular, decrease blood loss and painful periods, decrease the risk of ovarian cysts, and also treat acne. Remember to take one tablet each day at the same time to maintain its effectiveness. Using this medication does not protect you or your partner against sexually transmitted diseases. Before you start taking this medication, make sure to read the patient information leaflet provided by your pharmacist, as it contains important instructions on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. You should take this medication by mouth, with or without food, as directed by your doctor, usually once daily. Try to pick a time of day that is easy for you to remember, and take your pill at the same time each day. It's crucial to continue taking this medication exactly as prescribed by your doctor. Make sure to follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses, and try to take the medication at the same time each day, 24 hours apart. Your pill pack contains 26 pills with active medication, 24 pills with norethindrone and ethinyl estradiol, 2 pills with only ethinyl estradiol, as well as 2 reminder pills with iron. Take one active pill, with hormones, once daily for 26 days in a row, followed by one reminder pill, with iron, once daily for 2 days in a row, unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. If you are taking other medications that can interact with iron, such as certain antibiotics, ask your doctor whether you should throw away the reminder pills, iron tablets, each day rather than taking them. Iron can decrease the effect of these medications. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, make sure to consult your doctor or pharmacist for information on how to use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience nausea, vomiting, headaches, stomach cramps, breast tenderness, swelling in your ankles or feet, or changes in your weight, these are common side effects of Norethindrone-E.Estradiol-Iron tablet. You may also experience vaginal bleeding between periods or irregular periods, especially in the first few months of use. It's important to contact your doctor if these side effects persist or worsen. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, it's important to monitor your blood pressure regularly, as this medication may raise it. Contact your doctor immediately if you experience a lump in your breast, changes in your mental health, unusual changes in vaginal bleeding, dark urine, severe abdominal pain, or yellowing of the eyes or skin. In rare cases, this medication may cause serious problems such as blood clots, which can lead to conditions like deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you experience symptoms such as shortness of breath, chest pain, sudden dizziness, severe headaches, or changes in vision, seek medical help immediately. While a serious allergic reaction to this medication is rare, it's important to seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other unusual symptoms. If you are in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you are a smoker and are over 35 years old, it is important to avoid using this medication as it can increase the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure. This risk becomes higher with age and the number of cigarettes smoked. It is crucial to refrain from smoking or using tobacco while taking this medication. It is important to keep iron-containing products, such as this medication, out of reach of children as accidental overdose can be fatal. In case of overdose, it is important to seek medical help immediately or contact a poison control center. Before starting to use this medication, it's important to talk to your doctor or pharmacist about any allergies you may have to estradiol, norethindrone-iron, estrogens, or progestins, as this product may contain inactive ingredients that could cause allergic reactions or other problems. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have a history of blood clots, high blood pressure, cancer, high cholesterol, depression, diabetes, heart problems, kidney or liver disease, thyroid problems, or unexplained vaginal bleeding. If you have diabetes, this medication may affect your blood sugar, so be sure to check it regularly and share the results with your doctor. If you have surgery planned or will be confined to a bed or chair for a long time, it's important to let your doctor know, as these conditions can increase your risk of getting blood clots, especially if you are using hormonal birth control. It's also important to be aware that this medication may cause dark areas on your face and skin, so it's best to limit your time in the sun and avoid tanning booths and sun lamps. If you are nearsighted or wear contact lenses, you may develop vision problems or trouble wearing your contact lenses, so be sure to contact your eye doctor if these problems occur. It's important to note that it may take longer for you to become pregnant after you stop taking birth control pills, so it's best to consult with your doctor. This medication should not be used during pregnancy, and if you become pregnant, it's important to tell your doctor right away. If you have just given birth or had a pregnancy loss/abortion after the first 3 months, talk with your doctor about reliable forms of birth control, and find out when it is safe to start using birth control that contains a form of estrogen, such as this medication. Finally, it's important to note that this medication may decrease breast milk production and may have undesirable effects on a nursing infant, so it's best to consult your doctor before breastfeeding. It's important to be aware of any potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to discuss any new medications with your doctor and to consider using additional reliable birth control if necessary. Additionally, be aware that this medication may interfere with certain lab tests, so it's important to inform all your doctors and lab personnel that you are taking this drug. As always, follow your doctor's guidance and do not start, stop, or change the dosage of any medicines without their approval. If you or someone you know has taken too much of this medication and experiences severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to take the recommended dosage of this medication and seek medical help if you suspect an overdose. Remember to keep this medication out of reach of children and pets. It's important not to share this medication with others. While taking Norethindrone-E.Estradiol-Iron tablets, it's essential to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. Make sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's crucial to keep all medical and lab appointments. If you need more details, consult your doctor. When it comes to the daily dosage, follow your doctor's instructions carefully and take the medication at the same time each day for the best results. It's also important to take the medication with food to help prevent stomach upset. The optimal timing for taking this medication depends on your individual schedule and habits, so consult your doctor for the best time to take it. If you miss a dose, the advice on what to do next will depend on the brand you are using and how many doses you missed. You can refer to the product package for specific information on what to do if you miss a dose. It is important to use backup birth control, such as condoms or spermicide, to prevent pregnancy if you have missed a dose. If you frequently forget to take your pills as directed, it is a good idea to talk to your doctor about possibly switching to a different form of birth control. It is important to store Norethindrone-E.Estradiol-Iron tablet at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. When taking Norethindrone-E.Estradiol-Iron tablet, it is important to follow the prescribed dosage and take it at the same time every day. This medication is typically taken once daily, with or without food. It is best to take it at a time that is easy for you to remember, such as in the morning or at bedtime. Some of the benefits of taking Norethindrone-E.Estradiol-Iron tablet include regulating your menstrual cycle, reducing the risk of ovarian cysts, and treating symptoms of menopause. Be sure to take it consistently to experience the full benefits. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.